Good afternoon and welcome to the formal launch of the Organic and Natural Health Association. I want to thank our audience for being here, and I want to thank our audience that will be watching on the web after we record this. It will be put on our YouTube channel for viewing by our national audience, internet, and all of our consumer participants. To the purpose of today's event, and by the way, I am Karen Howard. I am the Executive Director and CEO of the Organic and Natural Health Association. The purpose is to introduce to you our mission and vision for the work that we intend to do, and to initiate our public dialogue on the beginning of how we define natural across several arenas, starting with food, pet food, cosmetics, and of course dietary supplements. The association was founded on 4 principles. Our commitment to sustainability, which includes the processes and practices that ensure restorative, natural work and socially responsible action. Transparency, by creating an honest and unambiguous relationship between customer and corporation. Accessibility, and our commitment to health and wellness by broad access to organic and consumer products and services. Traceability, and our commitment to integrity, holding suppliers, manufacturers, and distributors accountable to quality supply chain standards. These are the principles that we believe will help us articulate our work in the following areas. Our desire to preserve and promote the integrity of organic. Our want to educate and engage consumers and businesses in a two-way, trustworthy conversation. The development, of course, for a certification of natural based on a transparent and collaborative process. Advocating on behalf of our members who comply with those standards. And more importantly, endorsing and supporting quality research for documentation of fair and non-misleading health claims. So to this point, I will now begin to introduce our panelists, and we will begin our conversation. And let me start with our president, Todd Harrison. Todd is a partner at Venable, as most of you know, where his legal practice focuses on federal, state, and international consumer protection agencies that govern regulations associated with drugs, food, dietary supplements, homeopathic remedies, medical tools, and cosmetics, primarily in the U.S. FDA, USDA, Food and Safety Inspection Service, and the FTC. With extensive experience in the areas of food and dietary supplements and marketing, Todd has advised and assisted numerous clients on requirements and compliance issues. He has a successful track record defending against FTC advertising complaints, enforcement actions, and prosecutions, as well as defending competitor challenges in court and other forums. So I know that most of you are here because of our collective interest in what it means to have natural products in the marketplace. But I'm going to start back at the beginning of our story and the original action that Organic and Natural took in July when we first announced that we were in the marketplace. We've just entered into a partnership with a group called Grassroots Health, and it's a consortium of experts, scientists, committed to nutrient research. Grassroots Health will actually support Organic and Natural by evaluating the impact of nutrients on health outcomes, primarily for the purpose of developing public policy positions. So I mentioned that, Todd, because in July we submitted comments to the FTC around a particular issue with independent research conducted by a corporation and the claims they use, the substantiation of those claims based on that research. So my question to you is, how does the relationship between Organic and Natural and the work we want to do with research impact what will happen in primarily the dietary supplement industry, and what do you see as the future of that as we move forward?
Well, I think in that regards, what we have lately, probably over the last 10 or 15 years, is a utter disregard by our own trade associations in the industry of what really is science, and not effective advocacy within that framework. We are now dealt with a Federal Trade Commission that's very activist. And they take issue with every study that is done. They find fault with every study that's done. They take a standard, the 95% confidence level, which was never intended to be a rigid standard, which also was never intended to be a treatment effect, and have decided that's the holy grail. And so it's time for a paradigm shift. It's time for actual policy to be discussed and looked at. And in this regard, we can think back, maybe for some of you can't remember this, but I can. Back in the 1970s, there was a discussion that what's the role of food and nutrition in overall health. You'd have been laughed at back then if you had said that you could avoid 80% of chronic diseases by proper nutrition and diet and exercise. What do we know today? Indeed, we can. It's time to start moving these questions forward, these policies forward, because they're not necessarily going to be able to look at a double-blind placebo-controlled study and make that decision. And are we going to say that because a company that's done really good research and because they reached the 90% tile in the confidence level that there was no clinical effect? So these are the things that we need to start engaging regulatory agencies on. Similarly, as with natural, we need a definition of natural. We need to move forward with that. There is too much litigation going on. It's in the interest of everyone, including big corporations, small corporations, and consumers, that we have an honest debate of what is considered natural. And quite frankly, everybody has to understand what's natural for food may not be natural for dietary supplements, which may not be natural for cosmetics. Each one of these product categories have their unique challenges. If you go with a minimally processed claim for a dietary supplement, not one dietary supplement will meet that definition of natural. So by definition, all these will have to have different issues, and we need advocacy on this part. And if we don't get the advocacy and we don't engage the FTC, the FDA, state and local authorities into these conversations, and the consumers, because consumers ultimately have to trust whatever comes out, we're going to be in an unending cycle of lawsuit after lawsuit after lawsuit, because that's what plaintiff attorneys do. They look at it, they can figure out what the weaknesses are, and they can exploit those things. That's what their job is. That's how they make their money, and they will continue to do so. And that's why if we want to start eliminating lawsuits, and you're never going to get rid of them totally, we have to have a serious shift in the paradigm, something that a lot of trade associations are not willing to do. We want to live and die on the holy grail of DSHEA. DSHEA is outmoded. It is time to go beyond that. And it's time that we have a regulatory agency like the FDA not issuing warning letters over cough cold products. It's time that we shift this paradigm and have an honest conversation.
So let me follow up with that for a second and say, let's look in the crystal ball and let's say we're 6 months down the road and we actually have a certification and a seal defined for natural in food and dietary supplements. An aggressive target, but we'll just pretend that's what's going to happen. What would you say to a company that says, in this current environment, with all of the legal suits that are being filed, class action and otherwise, even up to the Supreme Court, how can you assure me that by going through the process to achieve this seal, I will be protected or my risk will be minimized in terms of lawsuit when I use the word natural?
I think when you engage consumers in the conversation, you get consumer groups that are agreeing with you, that's going to minimize your risk. If you can truly show a true standard out there, courts will listen to that standard and they will apply that standard. Now, that takes time. Nothing's going to shield you from a lawsuit. If somebody wants to sue you in our country, they can. It's just that simple. But if you don't have a standard, it's a much easier thing to pick at. And if we define what that standard is, and our members and companies that want the seal follow those standards, then you have a better position when you're at court. It's just that simple, and it's less likely that an attorney will want to go after you, or a state regulatory agency. we can't really count on FDA and FTC to come up with a definition because they don't want to, because they don't want that political mess. So it really is up to industry to go in there with consumers. Industry by itself is not the answer, because if consumers don't believe you, then you lose. FDA will not listen to just a simple industry backing on this one. It's too political. So I think that it helps you in court, but there's no silver bullet.